Hi, my name is Kate Dalbra, and I will be bringing you an epidemiological perspective in increases in suicide rates among American adolescents and teens. This is from Maternal Child Health and is the final project. And I really hope that the technology works with me today. I chose to focus on the epidemiological role in this process, and we'll take a moment to look at statistics as well as some of the social determinants of health. We'll also look at some of the interventions and the evaluation process for those. The situation, here we go, is which is another word for problem statement. That I chose is that suicidal ideation and completion has increased among Americans younger than 75 years of age, with the most significant increase among girls between the ages of 10 to 14. And we will look more about those statistics right now. So suicide rates across all Americans less than 75 years of age went up over 15 years from 1999 to 2014, from 10.5 per 100,000 to 13 per 100,000. Some of these statistics are not surprises and were well known. I think that the surprising parts are the bits that increase the most. So males had a higher rate of suicide completion than females, and females were more likely to endure suicidal ideation. Race is a factor, with Native American and Alaskan Indigenous peoples, as well as Caucasians, having the highest rate of suicide completion. So we talked about what was the most common, but concerningly, there were specific subgroups that showed the largest shifts, which were very concerning. So when separated by gender and age, there was a 3 times increase in suicidal completion among prepubescent and adolescent females aged 10 to 14. And when I read this was why I chose this particular topic as the mother of 3 girls that are quickly approaching this age group. There was also a concerning and significant increase among African Americans, which is a trend that should be watched. So there are many contributing factors that are very much linked to social determinants of health. So the diagnosis of a mental illness among teens is an issue. So while many teens have mental illnesses and have been maybe diagnosed with such, there's a reluctance these days to prescribe psych medications for teens and young adults because of the black box warning. The concern many years ago was that these medications would increase suicidal ideation among this population, as well as potential completion. But there is some data that suggests that this may not be the case, and that may not be the most helpful way to treat mental illness, and that in addition, we should definitely be diagnosing and treating with other modalities. Bullying remains a challenge, and bullying today is very different than bullying 20 or 30 years ago, whereas you'd go to school and be bullied or bullied on the way home. This is bullying that's available 24 hours a day, via social media, via text, and it's definitely a concern. Identifying as a member of the lesbian, gay, bisexual, transgender, or queer community can certainly be an issue, as well as health insurance. So there has been an increase in engagement due to the Affordable Care Act. However, the health insurance itself may be very high deductible and may be a barrier itself to people seeking care. In addition, young people often do not seek the appropriate care because of the cost, or it may be cheaper for them just to pay the amount on their taxes. Other contributing factors include familial discord, and we'll talk a little bit more about this later, and this may include parental separation, increases of single-parent families. Substance use disorder is also a large comorbidity at this time, and it's a very hot topic in the media, especially in New England, and is a hot topic in public circles, and hopefully in the future it will be looked at less as a criminal justice problem and more as a public health problem. Maternal mental health can also be related to suicide attempts and completion among the offspring, and this could be a reflection of nature, or as in genetics, or nurture as in behavior. So when looking at the socio-ecological model, It is a framework for helping public health professionals map out and better understand relationships between personal and environmental factors. And in looking at this, as the role of the epidemiologist, there's a lot of influences on youth suicide behaviors that's important to go through. From the individual level, an epidemiologist could determine commonalities among the girls that are admitting to either suicidal ideation or committing suicide. And this may include documentation or diagnoses in the medical record, commonalities in school psychological services or guidance offices, keywords found in online journals or diaries, or on Facebook or other social media, as well as commonalities noted from friends that are interviewed. From the interpersonal level, individuals that are bullied or know histories of emotional, physical, or sexual abuse, which are often referred to as adverse childhood events, are more frequently reporting suicidal ideation and suicide. And this can be found via mandated reporting, as well as diagnosis of post-traumatic stress disorder, reports from friends and family. And this can be challenging as some people may report unreliably, but it can be useful if you can find it. And from an organizational level, health services, have to look at relationships with healthcare providers. And so, using a very common validated tool may be helpful, such as something from SAMHSA, the PHQ-2 or the PHQ-9 can be useful in making this routine screening practices at every visit so that perhaps a change may be noted quickly and easily. And routine mental health screening would certainly be helpful. So at the community level, schools need to be able to offer mental health services, especially in a confidential way, in a safe way from the community, stigma, parents, so that people can access the help that they need in an appropriate way. Establishing well-visualized mental health services with access to validated screening, as well as creating a peer network can certainly be helpful in establishing this group, and can also help in looking at ways to change culture to create trust and create a successful way to treat a sensitive issue. From the policy level, policymakers can support this work by allowing appropriate funding, which is often a huge issue for people working within the system. Funding for enough FTE so that people can create opportunities to seek care, as well as improving reimbursement. So policymakers really have a lot of opportunity to help. In addition, they can also help in terms of culture change around stigma. So in looking at our interventions and recommendations, the first that we're going to look at is called SOS, Signs of Suicide, which is designed to educate and raise students' awareness, particularly in middle school and high school students, about the risk factors impacting both themselves, so creating a self-awareness as well as an awareness of others around them who may be at risk for suicide. So this program helps to decrease the stigma of mental illness. This is done via DVD, so staff is trained in how to facilitate these kinds of programs, and creates a network of individuals that are considered allies who can then help students and be approachable to students. This program of note was designated a program with evidence of effectiveness by the Suicide Prevention Resource Center based on its outcomes. Another program that I really liked was called Empowering Our Spirits, which is a program that is specifically for Native American youth and looks at things from a tribal focus, and also empowers the community to really take charge of their own issues. So we know that Native American youth are more likely to have a higher rate of suicide than other demographics. So by using some community-based participatory research principles, the tribal elders are both trained to create community around suicide prevention, as well as to create an evaluation program. So they really own this, both the intervention as well as the evaluation and any adjustments that need to be made. Another intervention that I really liked, that I was more thinking towards parents, when you look at parental involvement in the potential for suicidal ideation in youth, Together Strong is a program that provides peer support for service members returning from areas of conflict, and helps them to integrate back into civilian life. And in terms of looking at parental, issues, that would be helpful in terms of the PTSD rate, as well as the suicide rate of our service members, which then would probably impact familial life. Another intervention that I found kind of late in this project, I heard it on NPR, of all places, was the crisis text line. And so what this program is it's being advertised on the Golden Gate Bridge, where there's a very high rate of people jumping, particularly teens. And it's advertised for teens who are considering suicide to text and receive help. And so if they text, they get a volunteer. If the intensity of the texts increases, then a social worker follows this conversation, and then if at any point there's concern for the texter's safety, there is emergency services dispatched to them, which seems like a really lovely and available service for those considering suicide. In terms of evaluation, there are a few broad ideas that can help us to evaluate these programs. One of them is decreased suicidal completion, increased reports of suicidal ideation, and increased utilization of already existing services. And some of these may look like increased guidance appointments, increased outreach to mentors, increased text messages to the text line, increased reports of ideation, especially when going with a decreased suicide rate, or increased psych hospitalizations or ED visits, increased local hospital diagnosis of mental illness, increased prescription of antidepressants for both parents and their teens. You could do a pre and post evaluation of stigma of mental illness, as well as looking at larger assessments, such as the Youth Risk Behavior Survey. You may look to see a decrease in reported suicidal ideation, but also decreased reports of substance use and other risky behaviors. Potential challenges is that there may not be adequate access to referral resources. So we may be able to identify students, children who are in trouble, but we can't get them where they need to go. Changing culture can be very painful and slow and challenging, and requires a lot of work, as well as a few champions within the organization. Resources available. You need to have resources not only to establish change, but to also evaluate it and make sure that it's going well and you're doing it well. So I'm going to take a minute and show you my logic model before I run out of time. So there are, we have our inputs, activities, outputs, outcomes, and impacts. So for the SOS program, the inputs would be middle school students, DVD curriculum, the teachers and administrators, and time within the school day, which may be the most difficult input to get. There would need to be appropriate training and facilitation for the students. Outputs, there would be to offer the training and facilitate the workshops, and hopefully reducing the number of suicides, and increase requests for support, increase referrals to outside agencies, and impact would be increased resources, because there would be an increased need, thus necessitating an increased mental health resources within the community for the entire family, and improved referral process, so perhaps a formalized process. For the logic model for empowering our spirits, we have tribal support elders, teens, or youth mentors, and then for activities, there would need to be training, education for tribal youth about the resource, as well as education about the research and quality improvement techniques to make sure that the information that they're extracting is good quality. Infrastructure that can support this. Participants will be able to identify support people, and support people can then have resources and education necessary to impact. And hopefully this would lead to the impacts that we see, which are very similar to the previous. Together Strong, again, we have the military volunteers, space and time. They need the appropriate training and advertising. And again, reduction in suicide would be the hopeful outcome. And then in the logic models that for the crisis text line, we need volunteers, social workers, teens, and technical support, and then good training, which would then allow non-threatening ways to reach out for help, and an increase in looking for help and a decrease in